Hey everyone, today we are going to talk about self-harm. Self-harm, also known as non-suicidal self-injury or NSSI, is defined as intentionally causing harm to one's own body without the intention to cause death. It is estimated that as many as 4% of adults, 15% of teens, and 17 to 35% of college students report engaging in some type of self-harm. Based on my clinical practice, I suspect the true prevalence of self-harm to be much higher, but isn't being reported due to negative stigmas and misconceptions attached to self-harm. Discovering someone in your life is engaging in self-harm can be scary and can easily lead to unhelpful reactions. This video will discuss what self-harm can look like, reasons why someone may engage in self-harm, and tips for handling this type of situation both in the front and backcountry. As always, when discussing difficult topics, please take care of yourself and step away from this video if needed. Non-suicidal self-injury can present many different ways within patients. Skin cutting tends to make up 70 to 90%. Headbanging or hitting represents 21 to 44%, and burning between 15 to 35%. It is not uncommon for someone who engages in NSSI to use more than one method. These acts typically first happen in areas of the body such as the wrists, stomach, and thighs because they're easier to hide. As the self-harm becomes more severe, the person may begin harming more parts of their body, including their face. If you have never engaged in self-harm, it can be hard to understand why a person would do this to their body. It's also easy to make incorrect assumptions about the person, such as they're doing it for attention or that they're trying to kill themselves. In my work as a therapist, the most common reason I hear people engage in self-harm is due to emotional distress. This reason for self-harm is also backed up through research. The person is usually wanting to experience a release from overwhelming emotions, or they say they want to feel alive. On a physiological level, when we are hurt or stressed, our body releases endorphins, which act as a type of morphine. Our body can also help us dissociate from pain, which allows us to zone out. This separation from reality and positive feeling through endorphins are the rewards of self-harm and why people may continue to use self-harm even when they are experiencing other negative consequences. One challenging issue that comes up around self-harm is when your role requires you to inform others about it. If you are a mandated reporter, meaning you are a professional working within a certain field that often interacts with vulnerable populations, you may be required by law to report self-harm. Every state is different in how it defines this type of reporting. Mandated reporters within my state of Montana, and most states include, but are not limited to, teachers, doctors, social workers, therapists, and foster parents. If you ever have questions about mandated reporting, make sure to talk with your employer or look up your state's guidelines. When it comes to self-harm and reporting, if the person is a minor, it should always be reported. If the person is an adult, this can be a trickier situation since, as I mentioned earlier, self-harm is different than a suicide attempt. In these situations, it may be best to call the reporting hotline to ask. If you are a friend or family member of someone who self-harms, you may feel stuck with what to do. Encouraging the person to seek professional help is a great step and also getting help for yourself. It's important to not let self-harm stay in the dark, even if the person begs you to not tell anyone. There are many recovery options for those who self-harm, such as rehabilitation programs. Unfortunately, this can't happen unless the situation is talked about. Make sure you're including trusted individuals and professionals in your support network. If you're guiding any type of outdoor trip and a member of the trip begins self-harming behaviors or discloses to you about their self-harm, have a private conversation with the rest of the staff members and inform them. The staff leading a trip need to work as a team and should be part of making decisions based on safety for the participants. The fact that someone engages in self-harm should not be the sole reason to evacuate this person. Reasons to begin considering evac would be if the person has no prior history of self-harm, if they are not able to listen to directions, not able to be honest with staff, and if their behaviors or wounds are not able to be managed properly while out. As I spoke about earlier, there are different ways people may self-harm, and some may create more of a difficult scenario in the backcountry. This would especially include headbanging, which could mean a potential head trauma. So far, I have mentioned reasons why someone may engage in self-harm and why they might continue to. Now let's talk about the consequences that can come with these behaviors. The first and most obvious would be possible physical issues. This could include infection, blood loss, severe burns, permanent scarring, and nerve damage. Additional symptoms include inability to handle difficult emotions in a healthy manner, decreased self-esteem, increased feelings of shame and isolation from important relationships. Although self-harm in itself is not a suicide attempt, there have been accidental deaths due to severe self-harm. Some tips for working with someone who engages in self-harm starts with not overreacting. I like to take a step back and look at this behavior for what it is, an effective coping skill that comes with bad consequences. If possible, we don't want to give this person a lot of extra attention. Sadly, this could be another incentive they discover. When I hurt myself, I get extra love and attention. I'm not telling you to ignore the behaviors in any way. However, we don't want to begin favoring this person. Focus on wound management and get them to a higher level of care if needed. Get support so you're not having to handle this situation alone. Work with the person on possible coping skills that do not cause harm to self. Some options may be finding someone to talk to, practicing breathing techniques, drawing, and participating in healthy exercise. The person engaging in self-harm may have replacement behaviors they have used in the past or are willing to try out. These might require creativity to accomplish due to being limited on resources in the backcountry. You can also inquire if they have any prescribed medication that is helpful when they are wanting to self-harm. If possible, take away or lock up any items the person uses for self-harm. This may include knives, lighters, safety pins, or tweezers. In the front country, someone who engages in self-harm but is working on stopping can put their go-to item out in their car. Although they have the ability to walk out there and grab it, this can be an extra step which gives the person time to think about other options. In the backcountry, you also have to consider what is in your environment. Someone may resort to using sharp rocks or sticks to self-harm. Again, if it gets to the point where they are unable to follow directions and keep themselves safe, you need to consider evacuation. I hope this video has given you some more insight into self-harm or non-suicidal self-injury. Please remember, if you or someone you know is struggling with self-harm, get support. You don't have to deal with this alone. Thank you for watching.